Welcome to the Pivotal Podcast. Today we're joined by Shaun Garcia, the Chief Quality, Data, and Analytics Officer at Brevard Health Alliance. Shaun is a dynamic healthcare executive with a comprehensive understanding of the current and future healthcare landscape. His expertise in integrating data, finance, and clinical programs has helped transform complex challenges into strategic opportunities in healthcare. In this episode, we'll explore Shaun's journey, his current work, and his thoughts on the future of healthcare delivery and informatics. Shaun, thank you so much for being here with me today.
You're welcome, Ben. Thanks for inviting me.
Yeah, absolutely. So let's start right with the work you're doing right now. Tell me about that.
Sure. Right now, I'm responsible in driving the organizational transformation from what is traditional healthcare delivery models known as fee-for-service to a more modern state that's called value-based care. And I'm also involved with the National Association of Community Health Centers in bringing and showcasing innovations to the national stage. And also personally, I'm working on a couple of initiatives. I'm working on primary care nursing program that I hope to launch with a university here so we can have some national training. And I'm in the middle of writing 2 books. So one is with a couple of leading physicians, and it's going to be on venture capital and healthcare. And the other is how to do value-based care.
That's super interesting. I didn't know about the books. It's really interesting because I was just at an event here in Charleston last week with the Low Country Healthcare Alliance, and that it's an association or a group that they're putting together that's pretty new, and the group behind it is like physician-backed capital. Yeah, so it's like a physician-backed like VC firm. So it's super interesting.
Yeah, cool. I think there's a lot of involvement, particularly on some of these newer models. And I think it's for a good reason.
Yeah,
we can get
that's
into
awesome. That. Yeah, for sure. So what do you love about what you're working on right now?
Oh, that's a good question. So, that's a great question. What I love about it is that value-based care and the transformation really allows me to use all the skills that I've developed over my career. And so by its nature, value-based care is cross-functional. So I get to use my public health background, my clinical background as a family medicine person, and my business background that includes operations and finance. And what we're going to talk about today is really informatics and analytics, and soon AI. So I'm kind of the glue that keeps it all together. Honestly, it's a really great place to be right now.
Yeah. It seems like you're at the forefront of all the exciting things that are happening.
It's taken some years, but yes, it's taken like 25-year build out, but yep. Yeah, I'd say so.
So with that though, what do you wish were different?
Well, I think it's a broad question, but I'll see if I can approach it from a couple of different angles. So as a person that's trying to push the edge, I would say that regarding healthcare delivery, I would say that I would love to see more policies a little bit more aggressive that pushes the healthcare system into value-based care that really is about valuing health and not sickness. And by doing that, you'd really be able to nudge, I think, a little bit faster the whole, the healthcare delivery system. So transformation is hard. And so I understand CMS's perspective. So I would say if I could see something different and wish something different, I'd say like a little bit more aggressive on the health policy side to align us all up, including hospitals, long-term care facilities, ambulatory care facilities. And then I would say on a smaller scale, I would say I hope and wish that others in the system take a broad generalistic approach, because I think that's going to benefit them in their careers. So if you're to say a pure analyst, it'd be good for you to understand the business side of healthcare. If you're a pure clinician, it'd be good for you to go and understand the data component of healthcare delivery.
I think that that makes sense. So that is it. Tell me a little bit more about that. So, is it from the perspective of being able to understand, like to have more empathy, like sort of for the other side of kind of what's going on?
Yeah, I think you make a good point. And we'll probably get to this a little bit later, but because value-based care and the current model of healthcare delivery is it's woven together, right? So let's contrast that to the previous fee-for-service model, or it still exists. In the fee-for-service model, the business side could manage an entire system because it's for lack of better words, easy mathematics and it's widgets, right? If I perform a service, you'll get paid for the service, period, right? So you multiply that across different departments, you multiply that across different portions of your healthcare delivery system, and an accountant could do that, right? The challenge is value-based care is about bringing together the clinical side and the patient side to really hit the mark on what, and I don't know how many years ago this happened, but the Institute of Medicine used the phrasing, getting the right care at the right time at the right place. Value-based care is a product of that vision from the Institute of Medicine. And so you weave together clinical medicine with outcomes that are tied to finance. And that's what's really holding the system back, because there are not a lot of people that can weave them together to be able to improve health, drive down total cost of care, and make money for their system. And so that's why I just always encourage generalist thinking, systems thinking to anyone now, because it's just so necessary. I hope that answers your question.
Yeah, I think I'm understanding that it's more about aligning like financial incentives with the outcomes rather than the services provided.
Right. That's a great synthesis.
Cool. So let's go back for a little bit though. Tell me about your journey, right? So where'd you get your start and how did that lead to where you're at right now?
Yeah. That's another good question. You have a lot of good questions here. So let me see. I'll start by probably keeping two things in mind. One is that I've always had the long-term view of my career, even when I was getting started out of college, right? So I've always had a long-term view. And then the second thing that I'll share, because I think there may be others out there who think this way, but I've always enjoyed being a generalist. And I think those two things have now come to fruition for me, where there's a reason why. I always, out of college, so to begin with, and I'll hope I can connect this and remind me to do this later, but the fact that I studied sciences in college, I did chemistry and biology, and of course you have to do the other sciences with physics and math. That, without knowing it, set the stage for my data journey to 25 years later. But I started in public health, and that's something that I was always passionate about. I was always interested in understanding community health, understanding population health. And so after college, I studied at the University of Texas Health Science Center. And from there, I went on and studied medicine. And from medicine, you notice that, at least I noticed, that you don't really have such a strong impact, particularly, let's say 15 years ago. It's improving now, but still not the same, where you're affecting the system, right? Because in the delivery system back then, even now, under the fee-for-service, you just have to ensure that you're seeing patients and doing things so that the system continues to generate revenue, right? So that's something that was always on my mind, was how do I have a better impact? How do I help shape the decisions that are being made? And so that prompted me to go and study and really apply business administration. So I went and I learned. I went to Dartmouth for healthcare delivery science, and by then I was already exploring operations, already doing ops clinical ops, healthcare integrations, and then tying in finance to that. And so, I know we'll get to this, I think, but after that was when I really understood the power of analytics and data. So I was dabbling in that really with a phenomenal BI team back in California. And it wasn't until I got to my current location that I knew we needed that skill set, and it didn't exist. We were a completely data naive healthcare delivery system. And because I knew we were going to go to value, I didn't have a choice. So I kind of out of necessity learned informatics and really formalized my education in analytics. Long answer, but there you go.
Yeah. So speaking of informatics, how do you define, I feel like it's a little different for everybody, but how do you define health informatics?
So I just think it's a field that combines information technology, data management, and healthcare. That's a simple, and there's a lot that goes into that, but I think at the highest level, it's probably what I would define it as.
Yeah, absolutely. So how do you feel like your background in medicine and clinical care shaped your approach to healthcare administration and leadership?
Well, that was the bedrock of my health admin and leadership. Personally, I'm not sure that I'd be as effective as an administrator without my clinical background. And that's all because of the transition to value-based care. I think if it was not a transition, you can be impactful in a fee-for-service space, but nevertheless, you're not the ultimate decision maker in that process. But when you can tie in that clinical background to outcomes and financial incentives, then that's really a game changer.
So thinking about like changing the game that way, right? Tying those outcomes together. Tell me about what you feel are some of the most significant changes or projects you've been able to implement in your current role at Brevard Health Alliance.
That's a good question. Let me reflect. I've been there 4 years now, and I would say that if I think back to the first time that I spoke to the team and I interviewed, I know that my CEO at the time had an idea, right? I think he was also probably a more modern thinker, and he was new to the CEO role. He was a CFO before. And he knew that value-based care was coming down the pipeline, and he knew it was important, but he just didn't know how to do it. So I had the chance to step in and really provide the vision and all the principles that are involved in getting there. So, and this is part of my book. So I decided to write these principles down in a way that anyone can pick up and plug in what is perceived to be out there as really hard to do. And it is, transformation is hard, but the principles behind it are not. And so I get to really work on the cadence of change. So I start with change management and ensuring that my adaptive leadership style suits the organization. I was also involved with the data infrastructure. And from the data infrastructure, building out with the teams, population health management. And based on population health management, we've been able to refine operations. And really last has been, we've been able to benefit from some of the savings that we've been able to get back on some of those sweat equity type of ideas.
So how do you leverage data and analytics to make that happen, right? To drive those value-based care initiatives?
Oh, data is the second most important principle in healthcare delivery, and particularly in value. The first is change management, because without change, you can buy any tool and it just will not work. But it's really, once you get changed on, you've got data. That is the heart of everything that you do. And we're not unlike any other industry. When I read about other industries that are trying to, not necessarily, other industries call it monetizing it, but it's really just using insights that you get from it. So I think for us is using data to inform all of the decisions that we're making. I think that's really, it's a data informed, truly is a data informed operation.
All right, so Shaun, can you tell me a little bit about the transition from fee-for-service to value-based care and the role that data plays in that process? And if there's like a specific outcome that you're looking for patients, or what other kinds of things are you considering in making that transition, and how does data play a role?
Well, it's a great question, Ben, and it's a broad question that has a lot of meat into it, but I'll try to give you one specific example, maybe two. So one of the challenges, so let's start by saying that by having data, it gives you at minimum the ability to gain insight. And that's one benefit that data provides you in the transition. So let me add a little bit more to that. So let's consider the challenges that are occurring in behavioral health right now. Everyone says that there are not enough clinicians to support the population, right? And what I've found is, I'm not sure if that's necessarily the case, but let's say we have data for our behavioral health patients. And until we went through the process of risk stratifying our patients, every patient who had a behavioral health challenge was allotted the same amount of time and the same amount of and frequency of visits with their behavioral health specialist, right? But it wasn't until I sat with my chief of behavioral health that I said to him, there must be a way, there has to be a way for us to better understand that population and tailor operations to be able to support the patients and where they're at. So this is where we had a chance using data. And this is where the clinical insight comes in, is our behavioral health department created really a score that says, based on my experience, I believe this patient, according to these categories, should be a low risk patient. And we have other patients who say have really significant challenges, and they've been in inpatient psychiatry, very, very challenged. And maybe that patient is a high risk patient. And perhaps we get a chance now to alter or change and modify our operations to say, you know what, the patient who's high risk should probably be seen by our therapists whenever they need to, right? So how about we leave some space for them inside of their the schedule for these types of patients. And the patient who's very low risk and really just wants to speak to somebody, well, when we're thinking about resources, perhaps it's better to connect them with a case manager, and that's just supporting them, and then they can reach out and schedule, let's say, once a month with our clinicians. Without data, that's impossible to do.
That makes so much sense. I mean, it's intuitive, right? Because like when we look at like physical
Oh, absolutely.
conditions, when we look at physical conditions, you're not going to do the same thing for someone who had a paper cut versus somebody who's got like an aneurysm, right?
Right. You're right. And you'd be shocked though when, this question I asked the same question to we had someone who was in the role when I first got there, and he was a clinician, only a clinician, and he had so much trouble articulating the ability to better understand the population. It was shocking to me because I just thought you could do that, right? And I think this is where I encourage, even if, let's say, you're just purely a clinician, understand, move into the space of, what is population health management? What does that mean in my field? And I'll give you one more that I think is just on the precipice. Actually, there's two fields in healthcare delivery right now that are just the precipice of getting this, well, maybe three, because I just mentioned one, which is behavioral health. Dentistry is at the very beginning of understanding the power of data and informatics for themselves. It's such a new idea to them. And I hear them speak sometimes, and we have the benefit of having a dental business where we are. So I get to take and apply the work that I've done the last 10 years to the dentistry field. And it's fascinating to see because it's so new to them, but they also know because of economics, they're getting the pressures to have to transition. And the other field, so aside from behavioral health dentistry, the other field that's now exploring this, because I also consult for value-based care for other parts of the system, and it's a long-term care space. And they too have, and in fact, they're at the same stage that dentistry is. It's so new to them that they're just exploring how they can use data to better inform the patient care in these long-term care facilities. And I learned this because I was speaking to a couple of those larger businesses that really the long-term care industry was akin to hospitality, which I didn't know. I assumed they were healthcare delivery providers, and I think they view themselves that way, but they're really under the category of hospitality. So they have a ways to go, but they're eager to do this, and so they're also exploring how data can assist them in their transition, because they also want to be able to deliver better care to patients and frankly reap some of those financial rewards.
Interesting. Can you tell me more? What do you mean by akin to hospitality?
Yeah, so it's about ensuring that the resident gets opportunities to, it's more like a hoteling space.
Mm-hmm. Mm-hmm.
So that's very different from healthcare delivery, where perhaps you can still provide those hotel type of experiences for your patients, or I should say they call them residents, but for their residents. But if you want to participate, and they do, into value-based care, they're going to have to upskill themselves in a meaningful way and move away from just providing meals, providing entertainment to their residents, into a much more sophisticated environment. And they're seeing that, and they're asking questions around, hey, how do I utilize data to make sure that, let's say my patients in the residence, maybe they have sensors, right? There could be fall risks in your facility. And so how do I use sensors, and how do I capture that information? And then how do I use the information? Is it predictive? Is it just at the moment it happens? What about medications? Are there medications is there someone even monitoring well their medications, right? So they're just at the beginning of this, literally just at the beginning. It's fascinating to see this because we've gone through this in medicine already.
Huh. That's super interesting. And I wouldn't have thought about maybe either of those, but especially dentistry, right? Because in my mind, dentistry is sort of preventive anyway, like how you go every 6 months or whatever. But it's like, I wonder what other kinds of things they're taking into account to try to leverage data and informatics, and what kinds of predictions they're trying to make with that, and what kinds of outcomes they're trying to change.
Yeah, it's the same. It's really the same principles. The principles are, the industry does not have population health management. So it's all fee for service. So your outcome, you could come see a dentist once every 10 years. And now the reason why this is happening, and I always share this with my peers, is that economics drives healthcare delivery. So pressure is coming down from the federal government on dentistry to say, hey, dentistry, the fact that you have not been monitoring patient populations is now costing me on the ER side, because now I had to treat an abscess that should have been treated at the dentist for $100. Well, now I'm having to pay $500 at the ER. So it's a system pressure that's coming down on everyone that and I think it's for a good reason. I'm not a fan of fee for service for what I've talked about today, but that's the idea. Is there is no real, in fact, there is no population health management in dentistry right now. They're just not. It's literally fee for service, and that's just the nature of the business.
It's really interesting. Like they'll have to, I guess, I don't know. This is sort of kind of going off a tangent. Maybe if I dive into this, but the
It's okay.
idea of where do they even start with that? Like, are they able to say, hey, okay, when it comes to population health, there are already populations organized, so we can take those from medicine and then start using data to track the groups that are already formed? Or do they have to go back a step even from before that and say, okay, now we've actually got to create the groupings because they look
Good
different with the things we're
question.
focused on?
Good question. Yeah, excellent question. So they need to do it themselves, right? And that's where, and I know this because similar to the conversation that I had with my new chief of behavioral health, that I said, in order for us to deliver value-based care, these are the principles. Help me understand in your business what this means. And he instantly got it, and we put together this program. It's the same idea in dentistry. I'm a physician, I am not a dentist. So I don't understand population health through the dental lens. I know you have to have it. I know you have to be able to risk stratify patients, but what that means, and I've learned some, right? I have enough knowledge and background to learn some of it, but I am not at all the expert. And so that really requires dentists to have to sit with people like me. And that's been challenging because there are not a whole lot of dentists out there that can do that. I have had the pleasure of speaking to one of them. He was, I believe, the national director for value-based care at DentaQuest at the time. His name is Dr. Barefoot, and him and I spoke the same language, but he's just one of a few, right, that I think are in the space that can do that. And so it's the inception of it. It will happen. It has to happen. So we're just getting the beginning of it. So I hope that there will be dentists in the future that are studying data and studying informatics, because it's going to be there.
It's so interesting. I mean, to even conceptualize, like when I think about the dentist office and what my
Yeah.
experience is like, I don't think about my dentist going back and looking at a database and being like, okay, look at these trends and this is what's happening and this is what we're noticing.
Yeah.
Whoa.
Yeah.
Not that they
Yeah.
don't, but I don't
Yeah. Well,
imagine
they
it for
don't.
sure.
They
Yeah.
don't do that right now. No, because it's so new. But when you think about, and I would say this is going to impact anybody who's taking an insurance plan, because just like I do that, I talk about this in on the medical side and even the behavioral health side. If you are a cash paying patient, there's going to be someone who's going to want to do care on you. And there are some clinicians who are only cash pay. That's not the majority of healthcare delivery in America. The majority is either paid for by the feds or by your employer. And the employer can't continue to pay for increases in healthcare costs. It happens every year, they increase, right? And the feds can't either, which is why pressure's coming down on the policy side on all these areas, because you have to control costs in a way that makes sense to the patients. And it's been a free-for-all for the last 40, 50 years.
Wow. Yeah. Yeah. Something I've definitely heard it talked about recently a lot. Like something's got to give to get a hold of
Oh yeah.
costs.
Oh yeah. Yeah, no doubt.
Mm. So you talk about all of these different things being sort of at their initial phases, right? How do you see informatics evolving within healthcare organizations?
Oh, that's a great question. It's it's something that I thought about when I decided to formalize my education in informatics. Is that I believe it's going to be, and maybe it's the word. I had somebody tell me it was like they didn't like the word informatics, and they were an actuary actually, so said that. So it's it's going to be increasingly critical to organizations of every size to have someone who understands software and healthcare. That's just the nature of it. And I think it's only going to be more in demand. And I just named a couple of budding large industries in healthcare delivery that we don't have enough informaticists in healthcare delivery and in medicine, let alone dental, long-term care. I mean, these are all opportunities.
Yeah, it sounds like, and I feel like when we talk about uh, we don't have enough here, we don't have enough there. The idea, and I don't know if this pops in everybody else's head, but there's already such a shortage. It's like just in healthcare in general, right, of clinicians.
Mhm.
And I don't know, I get this sense that it's like there's already a shortage, and now we need more people in informatics. And it's like, it seems like the idea is that that's going to make the shortage even worse, right? Because, oh, we're going to be taking people away from seeing patients away from the bedside and putting them into, looking at technology instead. But I don't know. I've always kind of wondered, since I started exploring informatics, if those people, it might be an initial, okay, they're stepping away from the bedside maybe, but the things they're working on, uh, are they going to be making healthcare delivery much more efficient so that it actually lessens like the problem of the shortage? Or if they can make the working conditions and the workflows uh, more effective, more enjoyable, less draining, whatever it is, reduce the cognitive load on clinicians. Will it be able to reduce burnout and actually then improve the shortage issue? Because if you've got a lower burnout rate, you've got higher retention rates, fewer people dropping out of the bedside healthcare delivery. Um, I don't know. It
Good.
seems to be like it could be. I don't know. I could see it going either way, I guess.
Yeah, Ben, I think you're thinking through what I would view as more of a leadership lens. So, I mean, it was interesting. I was thinking about this yesterday. I think yesterday was Sunday, where if you think you can't, you're right, and if you think you can, you're right, because it's a leadership question. Are you going to take the initiative to deliver better products, which means improving the experience for clinicians and for patients? Or are you going to sit back and let the market have their way with you? That's a leadership question. So fundamentally, what you're saying is you're going to have both sides of that. And I would rather be on the side that's driving change and ensuring that where I work provides a phenomenal experience to patients and clinicians, and using my background to do that, than to worry about not having enough staff. Because that's fundamentally, those are the two psychologies out there.
So with that in mind, is that the main challenge, or are there other more significant challenges that you're facing in your role now?
Challenges in my role, I think I've had the benefit of working with a great team, and because I work with a great team and because we're all aligned at the leadership level, we've had success in the principles that I've talked about. I think the challenges that I'm facing are really, and I mentioned this earlier, around the health policy side. So an example, it's necessarily informatics, but I'll share it anyway because it is a challenge I face, is when you think about the financial, which I think is principle number 5 in value-based care, is we've worked as an organization to develop a data-informed delivery process. And I'll give you an example. We had a large group of patients transition over from one health plan to another health plan, which doesn't sound like a big deal, but the other health plan, we don't have a contract that supports value-based care. So we made investments, both capital deployment and sweat equity, to build a system to deliver better care. And this new health plan is a fee-for-service health plan. So that to me is aligning incentives the right way across the system. So that's what I'm dealing with now is, hey, health plans, we've put this program together and we need to get reimbursed the right way so we can continue to deliver this kind of care. So Not informatics, analytics necessarily, but still a challenge nonetheless.
Yeah, wow, that's really interesting. Um, hmm. It seems like that would, in anything you do in business, right? In healthcare's business, right? But in anything you're doing, if you're devoting time and energy and money to build something, and then your customer effectively says, "Hey, actually, we want this other thing over here," man, like what can you do to prevent that and prevent that from leading to like wasted time, wasted money, wasted energy? I don't know if that's like a contractual arrangement or different customers or what that even looks
Yeah,
like.
yeah, you're right. Yeah, you're right, and your intuition around this is excellent. It's there are some opportunities for contract, but I think about it from really a national level, and I say there needs to be policy to prevent that, right? Because
Mm,
you can't continue to and what really, I'll give you an example. So let's apply data to this, right? So I took data from this health plan that we're getting paid fee for service on, actually Friday, and compared what they're paying hospitals and EDs compared to what they're paying us. And they're paying hospitals and EDs twice the rate. And that is rewarding behavior that we're working against. And so that, frankly, those are the conversations that I'm going to have with the health plan now. Is me directly is saying, hey, I'm seeing this. Surely you want to save money. Help us help you. And and this aligns with, I was in their analytics portal and I pulled all their data, I scrubbed the data, and I noticed that. And so, but from a larger policy standpoint, is having guardrails that won't allow that.
yeah, that seems like it. And I don't know because this is not my background, right? But like policy, but it seems like are we close, or are we still quite a ways off in that becoming like a formalized like public policy?
Oh, I have no idea. I'd like to think that it's closer, but we move, healthcare delivery moves at such a, what I feel like is a slower pace. It might be 5 years before I see something like that, which in healthcare is like kind of short time window, but in a business is like, well, it's forever.
Yeah, it makes sense too. Like they would have to, I guess, allow time for figuring out the incentives and the outcomes, right? So it's like we can't mandate something until we know how logistically it's going to work. So maybe that would be built in even when it does become policy. Um, yeah, that's
Or,
interesting.
yeah, or I would say, I wouldn't say it's up to them to figure out. I think that's up to us to figure out because we're the folks that are doing it. So
Right.
I would say put the guardrails in to force the discussion where right now it's not being, they're not forcing the discussion. So you've got folks in the delivery system that are choosing not to have it. And
Hmm.
that's what I would say. If you're going to do anything, force the discussion and let us sort that out.
Yeah. Yeah, and that's where I'm thinking with that. Like the example in my mind, or yeah, I guess the analogy would be like automakers. And it's like, hey, by a certain year, you've got to have a certain percentage, if not all vehicles need to be
Yes.
electric, right?
Yeah.
And so, okay, now go figure out what that looks like.
Yep. Yep. Definitely.
Hmm. So let's shift gears just a little bit here. I know we've only got a few minutes left. Um, I would love to hear what advice would you give to healthcare professionals looking to transition into roles like yours, or anybody looking to transition into maybe informatics or data or quality?
Good question. I would say, and I do give this advice to people, is to experiment and try things where you're at. Start to ask questions, ask for opportunities enter that will allow you space to work in it safely and in a place that just show interest and say, I have these questions, right? Like you could be, I mean, really could be anybody, any department, and just say, I have these questions and who can I work with to be able to get these answers that are probably rooted in data. And if you do that, in your department, whatever department that might be, with that in mind, most places are going to say, thanks for asking. Absolutely. Right. And then show me what you found out. And anytime you do that, I mean, to me, that's been probably that's provided me the greatest opportunity to learn and to grow professionally is that idea around ask questions, and especially I would say, and I forgot to say this, but if there is a priority in your department and you know that it's a priority because your boss keeps talking about it, then how can you help answer that question with data? I think that's something that I always try to share with folks is that's how you can do it.
I like that because it gives people an opportunity to kind of put a toe in the water where they're at right now. They don't need to go sign up for a formalized education program, right? Like they don't need to go back to school, which there's nothing wrong with that. It's just a much larger commitment, right? But right now they're able to go kind of explore and see, okay, how was that? Like, do I like data? Do I like looking at, things in informatics? And then they get to do it again where they're at and also start to make an impact on their current organization to fill a need that already exists where they are. So I think that's awesome.
I'll tell you what, I was always doing the job before I even got the title and before I even got the education. I just went to formalize it. That was all. Like I was doing business and operations before I went to Dartmouth. I was doing informatics analytics before I went to Tufts. I was doing all these things and it gives you so much more opportunity. And I think it gives people control of their career.
Yeah, that's awesome. Well, Shaun, I know we're coming to the end of our time right now. It sounds like you've got so many interesting things going on, especially with the books that you're working on and just all these other initiatives. If anybody wanted to keep up with what you're doing, is there a place that they could follow you online?
Yeah, you can. I'm on LinkedIn and I try to be, I think if you can put a link in at some point in this podcast, that'd be great. They're welcome to reach out and connect.
Yeah, perfect. Well, I really appreciate your time and all the insight that you shared with us today. Yeah, it's super inspiring to hear about your work to transform healthcare towards more value-based care through data and analytics. So thanks a lot for being here and for sharing that with us.
You're welcome, Ben, and thank you for the invitation. It was a pleasure.
Yeah. Yeah, absolutely. To our listeners, we'd love to hear your thoughts on this episode. You can share your comments on LinkedIn or directly on the podcast website at pivotal.buzzsprout.com. And if you know somebody who'd benefit from this conversation, please share it with them. They can listen live on LinkedIn or anywhere they get their podcasts. Until next time, stay tuned for more episodes here on the Pivotal Podcast.